Hi, this is Dr. Daria Hammer, a facial cosmetic surgeon, Washington, D.C. Now, talking about recovery. Now we're getting into recovery because I want you guys to get an idea what is entailed in a facelift. So we talked a little bit about procedures and techniques, and you can watch some of my other videos on my YouTube channel or on my Instagram, where I have a more detailed with before and afters and recovery. But this video kind of gives you an idea of the whole process and what to know and what you need to know. So the recovery process is not as bad as most of my patients think. Most of my patients are actually, when they come in, they're actually afraid of asking about a facelift because they think it's this horrible thing with horrible recovery. You look terrible, like you were hit by a truck, and it's going to be super painful. You have to be in a hospital for weeks. Yes, that's how it was a century ago. You know, what took back then 4 or 5 days at the hospital, today it takes 4 or 5 hours in the office, and you go home the same day. In the recovery process, really I tell my patients to consider a good 2 weeks. By that, I don't mean you need to be bedridden for 2 weeks. By no means. As a matter of fact, most of the times I have to tell my patients to relax and not to be too active, because most of them, after the second and third day, they say, "Doc, I really feel good. You know, can I go plant some tomatoes or do some reorganize my garage?" So I really have to tell them, no, I would take it easy. And I'll tell you what the reason for that is. The first 3 days post-operatively, you should rest. Okay, you should fully rest. Don't get your pressure up. Don't walk up and down stairs. Don't lift up anything heavy. Don't help your neighbors move. Don't lift up your kids, because anything that elevates your blood pressure could cause bleeding, and with that, bruising, hematomas, which is collection of blood underneath the skin and the muscle, and swelling in general. And all of those things could extend your recovery time. So you want to avoid that. Understanding this is very important because that could directly affect your final result. And of course, no one wants to shoot themselves in their own foot, and most of my patients are very compliant and listen very carefully. And that's, again, why I'm making this video. After the third day, you feel really good. In the first 3 days, usually post-op day 1, meaning the next day after the surgery, my patients come back to our office. We take the bandages off. We clean their wounds. If I place drains, and I don't place these old traditional drains that have a tube and a bulb where the blood collects hanging to it, just because my techniques are different. I use techniques where you actually barely bleed. The entire blood can be collected on a 4x4 piece of gauze, so therefore there is no drain necessary. When I do extensive and comprehensive facial surgery, anywhere from brows, eyelids, mid-face, face, neck, when I do an entire face, usually I put 2 little catheters, one on each side in the neck, which then will be removed the next day when you come back to my office, when we do your wound care. So we clean the wounds for you, take those drains out, and just put a more loose kind of head wrap on your head, and then you go home, and 2 days later, you will take it off, and you will be instructed exactly how to take care of your wounds. And hopefully you have a caregiver. It's especially important the first week that you have a caregiver, not because you're going to be in pain and you're going to feel terrible, just so they can help you with cleaning the wounds. It's very hard for you to see behind your ears and see what's going on to be able to clean your wounds. So a caregiver is really good. Could be your husband, could be your wife, could be your sister, your mother, could be anyone that understands how to clean the wound, and we will educate. Really, after the third day, you really feel good, and that's where I start getting worried that you're going to be too active. So again, for the first week, you want to take it easy. Typically, after 7 to 10 days, my patients come back to my office. If I have non-dissolvable stitches, which I rarely use nowadays, all my stitches usually are dissolvable, they will be removed. Sometimes I use staple in the back of the hair just because it's easier to keep clean and it's easier to remove than sutures because you can see more easily. Those are going to be removed after 10 days. And really, when my patients come after 10 days, based on these new techniques that I use these days, they're surprised at how well the recovery is going and how great they look. And all of them say the same thing. It's like, Doc, if I'd known that it's going to be so easy, I would have done it much sooner. And that's, again, another purpose why I'm making this video. And I have lovely patients that they were so excited and enthusiastic about the results that they told me, if anyone ever needs to know about the process, please have them call me. I suffered way too long. I would love to share that with them. And I have even patients that have made vlogs for me to basically document the whole recovery process. That's how I didn't even ask them to do that. So what that tells me is that their expectations were way worse than what the reality actually was. Okay, so I want you to keep that in mind, but I'm not trying to minimize, of course, it's surgery. Every surgery has risk, and there's going to be a separate video about risks, complications, how to avoid them, etc. Most of those risks and complications can be avoided, okay? And it has to do with the training, the expertise of your surgeons, the team. I have one of the best teams in the world. We have a state-of-the-art surgery center. And I'm really proud of working with my team just because they genuinely care about all of my patients and my patients' interests. They're basically my patients' advocates. And so, that's the most important thing, My patient's confidence is the most important thing to me, okay? Because in the operating room, I know what I can do. What's most important once the patient leaves is that they feel comfortable, that they have all the information they need to do the right thing. So preparation, like in anything, is everything. Not just preparation for us as a team, but for my patients before and after the surgery. And that's really the secret sauce to the success of any procedure that I do. Our last question that I frequently get, it's sometimes the first question that patients ask, is, Doc, if I do all of this, how long does it last? Do I ever have to do it again? That's a great question. It all depends on how the procedure was performed, meaning what technique was chosen, what age it was performed at, meaning how far the aging process had been progressed when you did it, and also your own DNA and your own biology. So these are the aspects that affect how long it lasts. Now, before I give you a long answer to this question, I give you the short answer, which typically we say anywhere from 10 to 15 years. I just recently saw a picture of a patient that I did a facelift on about 15 or 16 years ago now, and she still looks better, having aged 15, 16 years. She still looks better today than she looked before her surgery. So hopefully that kind of gives you a quick answer to the question. But going back to more detail about answering the question is that it really depends on what age you do this. So I have patients that come in their early 40s, they're bothered by their jowling and their drooping mid-face, and they say, Doc, I don't want any fillers, I don't want anything that doesn't last. I want to look natural, and I want this to last long, and I don't mind surgery because my sister had a facelift, and I saw it was not a big deal, so when can I schedule? I tell them, hold on, let me explain you everything first. And fast forward, really what that means is that you're getting rid of some mid-face drooping, some jowling, and maybe some tightening of the neck. Let's say you're 45, right? And so if you talk about 10, 15 years, that it kind of, in 10 to 15 years, you will look the same you looked before the surgery, which means how long it really lasts. Then by that time, you're about 60 years old, 55 to 60. So at 60 years old or 55 years old, you will look like you looked when you were 45. Now, to some patients, actually to most, it's very acceptable. I mean, who wouldn't like to look like they're in their 40s when they're 60 years old? I have some patients that had facelift prior, 15 years ago or 20 years ago, and a little bit jowling started creeping up, and they just want to have that addressed, and they've been through it before. And anytime you do a surgery early, or you do a touch-up surgery, what I call it, 15, 20 years later, those surgeries are little surgeries. They're not extensive surgeries. So meaning the surgical time is not that long, the recovery is not that long, and you kind of age gracefully because you don't get this extreme makeover. And to the point that no one really notices it, people will look at you and say, geez, you look great. Like, did you just come back from vacation? Or what kind of skincare are you using? They don't know that you had a facelift done. That's what I love about that. And recent studies have actually shown that the younger you are when you do a facelift, for example, the longer it will last. And it has to do with the biology of our structures, of our muscles, tendons, ligaments, fat, all of those things. They're just, they don't stretch as easily. So when you reposition them, they stay in those areas for longer. And that's why it lasts longer. And we have a lot of data from the 70s and 80s where patients had the traditional facelift that typically were done when they were in their 70s. And when you're in your 70s, your tissues are not as resilient anymore, and they easily stretch. And when they easily stretch, it's like a rubber that is worn out. It doesn't usually bounce back. And so when you pull the tissues back, they droop back down much sooner because the structure of the tissues is older. And so we can't change your tissues biologically. You know, when your tissue, when your muscles, your tendons, your fat, everything, your skin biologically is aged, it loses the elastin, which is the fibers that kind of make them resilient and make them bounce. So again, to recap, the younger you are when you do this procedure, the longer it will last and the more natural results you will get. The other answer to the question is the technique. Now, there's so many different techniques, and I mentioned shortly in the beginning of the video briefly about what these techniques are. But the technique that I most commonly use, because it just simply works in my hands the best, and I've done them all, so I have a good sense and good context as to what works best in my hands for my patients, is the deep plane facelift. What is a deep plane facelift? Well, our face has different layers. It has skin, fat, muscle and fat, and then the structures, which are the hard structures, which is the bone, okay? So these are the different layers. So considering the superficial layer, which is the top layer, the skin, well, the deep layer would be the muscles and the fat. So what a deep plane facelift really does, after just pulling back the skin a little bit, we go underneath the muscle and we reposition the muscle, and then the skin follows it. Okay, so we're repositioning the deep structures. The reason why that was suggested about, 40 years ago, is it yields a better lift, a more natural lift, without getting the pulled and stretched look, because you're not stretching the skin. Now, those techniques are also modified because you can also move the deep structures by pulling the deep structures using various sutures that are non-dissolvable or dissolvable. That's called a SMAS plication, for example. If you hear that reading somewhere, that's what it is. You're not elevating the deep layers of the muscles, you're just pulling it. So if you do like a mini lift, a little jowl or a little mid-face, that technique works just fine, and it's very quick. It takes an hour and a half, 2 hours max, and the recovery is easy. Now, the technique is also chose based on how extensive the surgery is going to be, and that has to do with how far into the aging process you are. So if you're in your mid-50s or late 50s, you have more significant aging, so there's more repositioning required. So in those cases, pulling the muscle might not yield the best result. You might not be able to pull it far enough. So you will have to do a deep plane to mobilize the muscles so you can actually reposition them to exactly where you want them to be without the muscles kind of pulling back on it. So you have to release more tissue so you can mobilize things. Most of my patients are about 50 years old. That's my average facelift patient age today. Used to be 10 years older. About 10 years ago, it was more like late 50s to 60. And now it's around 50. And last week or 2 weeks ago, I did a facelift on a patient that was 45, because it depends on how far in the aging process they are and what's bothering them. So there is no perfect age. Again, I don't want anyone to ask me, what is the best time for a facelift? It's not in your calendar. It has to do with what's bothering you, how far in the aging process you are, and most importantly, listen carefully, what results you are expecting, okay? The techniques and the type of procedure I choose have a lot to do with your expectations. So if you expect this to go like this, I can't do that with filler or Botox, okay? We're gonna talk about fillers and Botox in a separate video because there's a lot of misconceptions, confusions that have been unfortunately caused by marketing. So again, I hope this answers your question, and thank you very much for watching this video. And again, this is Dr. Daria Hamra. I'm a facial cosmetic surgeon in Washington, D.C. Have a great day.